finance professional.
I'm a mother.
I'm a social worker.
I am a wife and mother.
I'm a father and a husband.
I am a mom and a wife who struggles with bipolar and depression.
I'm a paralegal that struggles with depression.
Who struggles with depression.
She struggles with bipolar.
Whose son struggles with schizophrenia.
1 in 4 people.
1 in 4 people.
1 in 4 people.
1 in 4 people struggle with mental illness.
Struggle with mental illness.
I am not defined.
I am not defined.
Our family is not defined by mental illness.
I am not defined by my mental illness.
Christ.
Christ.
Christ defines me. Christ defines me.
I was diagnosed with paranoid schizophrenia in 1992.
I struggle with bipolar and depression.
My son was diagnosed at the age of 5 with bipolar. He's now 11, so he struggled with it for 6 years.
My husband was a combat vet. He suffered from post-traumatic stress disorder.
I've had 2 major incidents of major depression in my life.
My 2 daughters have had to see me go to the hospital in an ambulance. Just having to be a mom can be a struggle. And they're the ones that are affected the most.
I reached the point where I had a couple of attempts to take pills and commit suicide, and then thoughts that would not go away, and just a feeling of hopelessness that you just weren't going to get better.
It has probably been the saddest moment of my life to admit that I lost my marriage, mostly because of my illness.
We had to learn what it meant that our daughter was bipolar. We had to learn what it meant that our daughter didn't think that her life was worth living.
I mean, probably the darkest moment was Chad calling me the first morning after he'd spent the night in the mental hospital and asking me why I did that to him, why I put him there, and what he did wrong, because it felt to him like jail.
I remember looking and seeing my parents peer in at me, and the look on their face, what's going on with my son? What's going on?
Every day I came home, I feared opening my front door of what I was gonna see.
You know, at your lowest points in your life, you find out what you're truly made of. And it's not because of what you can do, but I've learned it's because of what God can do.
God's helped me and the church has helped me just simply by being loved and having that unconditional love and not being judged, knowing that I can be myself and not be afraid, because I am afraid a lot of times to admit what I'm going through.
My church has a support group for chronic pain and illness, and my pain psychologist suggested that I go. And initially I thought, goodness, I don't want to listen to a bunch of people whining about how much they hurt. I can barely deal with my own pain. But what I found instead was a place of grace and the beginning of my healing.
Through my church, they had a grief share program, and that basically was what I needed. It was a place that I could come and feel safe. It was a place that I didn't feel judged. I was surrounded by women that all have lost their husbands, and they knew the pain. We had that common denominator. And it was just a place that I couldn't wait to go to every week. And it helped me get through those dark days.
One of the things that I have come to be at peace with is that I will always have bipolar disorder. I will always struggle with borderline personality disorder. It's who I am.
And I had to move from this paradigm shift from I'm a schizophrenic, I'm a patient, I'm a consumer, or anything else that's there, to no. What God has to say about me is that I'm loved and that I'm his child, and that he, in his great compassion, wasn't angry at me.
I'm okay today, and that's a good thing. But a couple days ago, I wasn't. And I just want those people to know that there's hope, that there are people out there that want to help them, and that you can wake up the next day.
Don't give up. don't give up. There's always hope. Even though you may not feel it, there are people out there who care about you, that you matter to, and you matter to God. And you hang on to him, and he will get you through it.
Hi, I'm Claude Oliver, president of Tri-City Realty Group. Today we're going to go into the world of the mentally ill, the health care, the lack of it, going to Benton County jails, Franklin County jails, even what people have in other parts of the state that function and address this issue. With me today is Gordon Bope. Gordon is president of Washington State National Alliance for the Mentally Ill, local chapter advocate for a number of years, a connected guy in every respect. Kevin Kennedy, an advocate, consumer, stood up and said, I'm going to do something in terms of affecting this situation as it's affected his life. So without further ado, I'm going to go to Gordon Bope and ask him a little bit of his story. What's your story? How'd you get here? What are you all about?
Well, of course, like most families, you think everything's normal in your family while you're raising your kids, and at some point when your children happen to have been born with some brain chemistry issues, the behaviors start to take a turn in a direction that you don't understand. And these behaviors can have a wide range of activities, from very simple little things like obsessive behaviors with lining up pencils and papers and doing scribbling or whatever, to actually even strange activities, going out in the yard and talking to an alter ego or some voice you hear. In our case, two of our four daughters were perfectly fine throughout high school, and after high school started to show some signs of behaviors, particularly in being drawn to drinking, starting to drink, and some obsessive behaviors and stresses in their lives, and then they would respond by getting very, very stressed out. So when we got this issue, then we brought our kids to a psychiatrist to get some diagnoses, and at that time they called it manic depressive illness. It's now known as bipolar illness, and so both of our daughters, our youngest two daughters, were diagnosed with bipolar illness, and their behaviors, they got quite psychotic at times, and the behaviors resulted in some behaviors that got them arrested, such as trespassing, disturbing the peace, or shoplifting, and typically small misdemeanors. But they wound up in jails, and it started a vicious cycle, getting fined and so on. So we got involved in order to try to understand better how to cope with our young ones, how to deal with the problems that they have in a more effective way. And that got us into association with the National Alliance on Mental Illness, which is the nation's largest voice for families and consumers who struggle with mental illness.
Well, thank you, Gordon. I can say, as we look at issues, there's a lot of indifference, people just not stepping up, and you wonder why. Kevin, you stepped up, and you're in a consumer capacity. That's to be highly commended. What is a little bit of your story in terms of why you're here?
A little bit of my story is this. I'm bipolar, and I got diagnosed at 18. And when I got diagnosed at 18, I went through this, I call it the denial period. I don't have bipolar, I'm not that way. And then when years progressed on, the worse and worse I got. And when I hit my late 30s, I decompensated really badly. And I ended up, in psych wards and in jails. And I realized when I asked for help, the system was not there for the consumer. And I realized, wow, and I asked for help, and then there was a stereotype for the mentally ill. And the mentally ill, people think of themselves in downtown Seattle talking to themselves, not realizing that the mentally ill are doctors, teachers, lawyers. And my background professionally is I was a college track coach in the NCAA. And I came from a very professional level. But then, of course, I got sick and I had to resign. And so when I came back for help, it just wasn't there. So I decided to take the reins and start pushing for consumer advocacy for the mentally ill to get the necessary treatment he or she needs.
And you're now speaking about it. You've come up with one advocacy position for a warm line.
Mm-hmm.
Why would a person need a warm line in this town?
That is such a good question. The warm line is almost like a preemptive thing to reach crisis response. You know, let's say if I'm manic and I just want to talk to someone. I can talk to that other warm line, warm person on the other end that can relate, another consumer that's goes through bipolar or some type of mental illness, and they say it's okay to be manic. You know, this is how a way I can cope with being manic, and give that suggestions instead of them spinning out of control and then ended up calling crisis response. And then of course the police become involved, and then there's two ways they can go: to the psych ward or the jail. These are the two places where they get to go, and those two places are not a great place too for the consumer.
No, thank you. Gordon?
Yeah, let me add to that, because one of the things that got up my family involved more in this was in trying to seek help for our daughters. We encountered resistance, barriers of all kinds. When there was never help there when they needed it. And one of the sad parts of mental illness is that the illness itself is defined by the behaviors. So unlike physical conditions such as diabetes, when the pancreas fails to produce insulin, you have to take medications to treat that so your body can respond. The same thing happens with mental illness, but it happens to be the brain, and the brain chemistry is out of whack, and so you need to have the right kind of medications to help you cope with that. But you have to have those are expensive and prescribed medications. And in trying to get access to medications and access to therapy and other forms of treatment, it was almost non-existent, especially in our community here in the Tri-Cities. There was, when you needed help, there was very, very few crisis beds available. Crisis response was typically, well, they're not serious enough to be put into treatment program or to access some of the forms of care. So that, and the perception by the public and the understanding by the public of what it is to be mentally ill is sad to say, is just incomplete. People don't understand it, and that they're not criminals. That mental illness is a medical condition. And what we have done in our country here, and particularly in our area, when people act out because their behaviors are different and they're not normal behaviors, we have no place to take them. We book them into jail, and so now they're in jail, they decompensate, and they're charged with crimes that are directly attributable to the mental illness. And that's one of the serious shortcomings in our community, what led us to look at other options and try to find out what we can do to make our community better able to respond to people who are struggling with these illnesses.
Gordon, thanks for your advocacy. Yeah. Kevin?
I want to piggyback on what Gordon said. It takes 10 years on average to diagnose a mental illness and right diagnosis. What happened to me is I got diagnosed, oh, you're just depressed. But then, years later, all of a sudden I had the manic symptoms to it, and it took 10 years to dial that in. Other thing too about medications, they are so expensive. And for my bill, I have $1,300 a month for my medications to keep me grounded and stable, and access to insurance is also a big key for a lot of mentally ill, because a lot of them don't have the cash flow to buy their medications at $1,300 a month. I am very grateful to have insurance that covers the majority of my medications, but a lot of the mentally ill out there don't have that money, don't have that insurance, and that's where the barrier happens. That's where you see the spinning out of control happen.
Yeah, I think that the biggest misunderstanding is, again, given that if the community doesn't respond by having appropriate treatment facilities for evaluation and treatment, near term, short term, long term, or intermediate, whatever is required, when they don't have that, then the typical process involves booking them into jails, and you put them into a jail, which is the worst place you can put someone with mental illness, because they're put into restraint and isolation, all of which works against them. So if the community is going to step up and actually provide services, it's far less costly to the taxpayers to actually provide the treatment programs for people with mental illness, rather than putting them into incarceration or waiting until they go off the deep end and they wind up in hospital emergency rooms and very expensive clinical settings. So the biggest misperception is that mental illness is a medical condition. It's not a behavioral choice that one makes.
You know, the level is getting people the treatment they need, but also making people aware in the community, hey, you got to step up. One of the things is, you know, a pastor looking at his congregation has dozens and dozens of personal issues going on that he or she is very, very aware of. But, you know, what about stepping into the mental health community? Every fourth family in that church has mental illness within their challenges. So what do? And we want to get people involved. You know, this is a forum that we're going to publicly invite people to get involved to help change what's going on in this community. Number one, say your prayer, get up off your knees, take a walk, come out and join us on this mission to change mental health delivery in this community. Gordon, could you give a little bit about the statistics of people that are in mental health, that need mental health?
Well, yeah, Claude, that's one of the things that a lot of people are misinformed about. But the fact is that about one in 4 people in the United States will have a diagnosable mental illness in any given year. So it's not a minor consideration. It's a major difficulty. And there are levels of illness as well. But it's really important to note that the earlier they get into treatment and the earlier they're diagnosed, the more favorable will be the outcomes, and also the less costly would be the outcomes. Right now, as I say, we operate on a crisis system in which everything is the response is always to something that is extraordinary. They commit some act that is either resulting in damage, harm to themselves or others, and we need to stop doing that and stop making criminals out of people whose only crime, if you will, is to have a brain, psychological brain disorder.
Well, let's touch on that briefly. Benton and Franklin County jails, both maximum security. Extremely expensive to house a person with mental illness in a facility like that. There's a ton of cost, staffing, security, ongoing 7/24, and our sheriffs do a fabulous job, but you know what? There's a lot of people in there that don't belong there. Don't we have a better way to go than just locking more people up?
See, that's another thing, that if people with mental illness typically are held 3 to 6 times longer in our jails than another person who had the same so-called violation of the law. So they're 3 to 6 times longer incarcerated, held, awaiting valuation or whatever. And so that's a huge consideration. And the other thing is, if these people were diverted to a treatment program, they wouldn't incur the costs, the extremely high costs of jail, nor decompensate, or in other words, their condition gets worse the longer they're put in jail. So everything works against people if they happen to have a medical condition called mental illness.
You bet.
I know for a fact, you know, spending some time in some of our jails, is to get evaluated. It takes, like from Eastern Washington, you know, Eastern State, it takes 4 months to get that evaluation. And you're going to be sitting there waiting for that evaluation and decompensating along with it.
Now, could you imagine you go into a lobby in an emergency room and you sit there for 4 months before you can get attention? I don't think so. And we have people decomposing in jail, going through this experience, compounding the issues surrounding their illness, and we're paying the tab. I just got to think that if it was a for-profit or loss, we'd be broke. And you know, the unfortunate aspect is we ask the taxpayers to give us more money, but where's the money going? I mean, is it really going to, quote, emergency room status? The law and justice does what it can do. The sheriff is the victim of our community or the hero. He has to deal with people at the end of the road, because that's where they're going, whether he likes it or not. 724, and both sheriffs are doing commendable jobs with that. The challenge goes back to us in the community. What do we want to do? I mean, you know, do we want to build a one-stop? We want to organize our community. Let's take some action steps here today. Number one, write down the number you're seeing here for the National Alliance for the Mentally Ill, Gordon Bowe, and be in communication with him, because we don't want you to walk away, shut it off, and go down the road. We want you to come on in. We need your help. You know, what do you guys would you like to see our community step into in the next 60 days to start this transition moving?
Well, within the next 60 days, of course, one of the things that NAMI does each year during May, which is incidentally Mental Health Awareness Month, one of the things that we do statewide is we sponsor a walk for the mind of America, and we're hoping that we could actually get to the point of having a local walk. Right now, we welcome anyone to sign up to as a member of our NAMI Tri-Cities walk team, which we call the Tri-City Tumbleweeds. And so they can sign up for that. We have a website. If they just go to www.nami.org/WA for Washington, they should get to our NAMI Washington website, which describes the walk. They can sign up and they can either walk, or they can simply make a donation or sign up as a virtual walker. And so that's one thing. The other things that NAMI does, we provide a family-to-family training program, which is a 12-week free course for families to help families understand better about mental illness and help serve the local community. We also help sponsor our crisis intervention training for first responders, hopefully so that we can avoid people getting booked into jail on the first sign of a problem. So, and that, in fact, as we speak here today, we've got our crisis intervention training, CIT training, hosted by the Kennewick Police Department, which has been tremendously supportive. And that will be starting this Monday for a full week program.
Awesome.
So those are the kinds of activities that we can get into that will help to start to get this problem reversed. So we stop putting people in jail simply because we have no place else to put them.
Making some progress. I remember in 2006 when we had the jail mapping issue and folks came in and talked about crisis intervention training. Richland PD, who's fabulous now, but said, we don't have in our budgets, we don't have time, next, we're not going to do it. That's changing, so we are making some progress. Kevin, you're a sports guy, enthusiast background. Well, what would you like to see? Rotary, Kiwanis, who can get involved in this?
I like to see the Rotary, Kiwanis, all the social organizations to really see the benefit of a warm line. The warm line is very beneficial to the counties that have it, King County and Clark County, which we just visited. Their crisis response has gone down by 20–25%, you know, for suicides and that type of thing. I commend the county commissioners that I approached them back in January to say move forward with this. And right now there is a rough draft right now for a warm line for these two counties, Benton and Franklin County, and I want to see that in operation within 90 days.
So you're speaking to Rotary, Kiwanis, I assume church groups, anybody that will let you come in there, and church groups, step up. You got people that need help. We need to hear from you to get involved in this. Don't walk away. Say your prayer, and then let's go forward and do something about it.
Can you tell which of these persons has a mental illness? We're all affected in some way by mental illness.
When it comes to health issues, a lot of people forget about mental health.
Yep, that's Ty Pennington, the host of Extreme Makeover Home Edition, challenged with attention deficit hyperactivity disorder since he was a child.
You guys ready to move some feet? There's like a lot of people out there who really do need a lot of help with mental health. So yeah, anytime I can shine a light on that, I try to. So that's what the NAMI event's all about.
The fact is that 1 in 4 Americans will experience a mental health disorder in their lifetime.
I think the stigma is it's something that people don't want to deal with. They would rather just put them away and have somebody else deal with it. But the truth is that I think if you love someone and they end up having a mental health problem, I mean, you want to help them.
That's why thousands of walkers from all across the nation are walking for the National Alliance on Mental Illness, or NAMI, which works tirelessly to improve the lives of the more than 27 million Americans living with a serious mental illness.
I walk for NAMI because my mother suffered from chronic mental illness, and this is a cause that's just true and dear to my heart.
Because I have a mental ill son. I'm walking for NAMI because I have a mental illness, and it's important to educate, advocate, get out there and let people know that we're here.
Recruit your family and friends to get involved, encouraging them to send emails and letters, asking everyone they know to support NAMI Walks.